Dr. Scott Atlas, such a pleasure to have you back on American Thought Leaders.
Happy to be here.
It's been many months since we spoke last. It was in April of this year of 21 that we were speaking, and we were talking about some of the terrible consequences of lockdown policies. And we were talking a bit about Florida, where you had done advisory for Governor DeSantis. And I want to kind of dig into that a little bit. Like, how has Florida done? There's been a big surge. There's been a lot of criticism of Governor DeSantis's policies since then. And he's deployed monoclonal antibody clinics around as well to try to cope with some of this surge. Give us a picture of what you're seeing.
Sure. Well, I think we have to realize we're seeing something similar to what we saw last summer, 2020, where there was the virus spreads in sort of a geographical way. It comes and goes in waves, and we didn't ever seem to have learned from that. So when we look at the maps of the cases, we see, just like last summer, we had a surge in this time in the South, in Florida, Texas, and some of the southern states. And that surge came. It did not mean that somehow there's a unique case spread in the South because of some other reason, because now those cases came down, and we see cases coming up in the upper Midwest and the sort of Great Lakes region and to the east of the Great Lakes, just like we did last fall. So this is a cycle. We somehow don't seem to learn much from what we've seen over and over and over again. But that's what's happened. So in Florida, as a specific question, some of the things that have been said are completely untrue. For instance, there's a claim that, the cases are spreading because not many people have been vaccinated. I mean, this is just simply false. I look at the CDC data every single day, and what we see is that Florida has vaccinated at a higher rate than the country in every single age category. And those three categories that are tabulated are people 65 and over, all adults ages 18 and over, and total population. And in every single one of those three categories, Florida exceeds the vaccination rate of the United States as a whole. Florida has vaccinated over 95% of people 65 and older. And when I say vaccinated, I mean they've at least received their first dose, because we know that almost everybody essentially gets the second dose who gets the first dose. So for purposes of discussion, we'll say one dose or more. 95% of Floridians over 65 have been vaccinated. 3/4 of Floridians have been vaccinated who are all adults. And over 60% of all Floridians have been vaccinated. And so that is better than the average of the United States. So it's simply untrue to make that claim. What is the right claim is that there is a geographic wave that comes into these states. Now, Florida's performance has also been distorted, and I believe it's for political reasons, but I don't know. Hard to say why. The answer to the question why is always difficult. We look at Florida's performance, and we see that over the first year, the two characteristics that we should be looking at are excess mortality, which means all the deaths over the baseline that would have occurred without the pandemic. And Florida outperformed most states, 2/3 of states in the United States, in excess mortality increase during the year, the first year, March to March, roughly. They were outperforming the average in the nation in age-adjusted mortality, over 65. And you have to remember, Florida is one of the oldest states in terms of age demographic in the country. They have the second highest population of people over 65, and that matters because that's who's at risk in this virus. It's not equally risky for people at all ages. And then we look at Florida, comparing it to a similar state. And for a similar state, we like to look at California, because these are both large states, ethnically diverse, diversity in terms of the urban to rural living situation, and sort of similar climate, although I have to admit I prefer California's climate much to Florida's. I don't personally like humidity. And so we look at the data and we see Florida is the 5th oldest state. California is the 7th youngest, by the way. So right away, California has an edge in terms of what should happen. California did very strict lockdowns and prolonged school closures and everything. And so that's another good comparison here because Florida did the opposite. Governor DeSantis said no, he's not going to lock down completely. And in fact, he opened up widely at the end of August 2020 and opened all schools 100% in person if parents wanted. And so he did not suffer the damages of those prolonged lockdowns, which are enormous. But looking simply at the data from COVID, Florida did better than California in age-adjusted mortality from COVID. Florida did better than California in excess mortality. Florida was the #1 ranking state of the 10 large states in the country in age-adjusted mortality from COVID. You have to realize the burden to outperform is not on the states that did not do the lockdown. The burden is not on Florida to say it did better. The burden is on the other states that did the draconian measures, that destroyed people, that killed people with the lockdowns, that sacrificed our children with the school closures. The burden is on them to outperform Florida. So a place like Florida, they just have to do reasonably close to these other states. But in fact, they did far better.
And it's just that at the moment, they're experiencing a surge that California hasn't experienced yet.
Well, so Florida had their surge. Their surge for this surge peaked around August 15th. The cases started coming down at the second half of August. Now we're in, say, mid-September at this point, and we see that the cases not only have come down in Florida and the South, but the spread, the rate of spread, this so-called R value that people talk about, is very low now in the South, and it's higher and above 1, which means it's spreading rapidly in the Great Lakes regions and the upper mountain Midwest areas, and so they're getting more cases. Florida's and the South are past their cases. Now, the impact, though, again, you can't be focused on cases. This is another sort of repeated mistake by people analyzing the pandemic. The question is, who's dying? Who's getting the severe illnesses? Getting a positive PCR test is not being sick. They're very different things. Yet, we've seen this time and time again, that there's this very bizarre focus on stopping all cases of COVID when the real focus should be stopping the serious damage from COVID, stopping the serious critical illnesses from COVID, the deaths from COVID. And so that's the whole point of making sure that the high-risk people, the elderly people, are getting the vaccine. That's called targeted protection. They need it first. It's not true that the virus is high risk for most people. In fact, it's the opposite. It's not high risk for most people, and particularly not for children, for instance. So we look at how things have gone in this last surge, and yes, we got a lot of cases, and yes, we got some deaths. But the two things to stress is that with this Delta variant, which is the overwhelming number of cases in this recent surge, it's less lethal than the original surges. And what we mean by that, why do I say that? Because less people are dying divided by the number of cases. Now, why are less people dying? Number one is that, as we expect, anyone who knows anything about medical science, first year, second year medical student, as a virus evolves, it typically becomes less lethal, not more lethal. It survives by having mutations and evading the limits of the protection in the population. But with that, it usually gets less lethal. And so we're seeing less lethal data, less number of fatalities per cases. And it's also partly, of course, because we are vaccinating a lot of the high-risk people. That's the goal of the vaccine. The goal of the vaccine, a vaccine does not necessarily stop the infection per se. That isn't the main purpose. The main purpose is to make sure people stop dying. And we are seeing far fewer people dying considering the number of cases And that's true all over the world. When you look at the data in the UK, when you look at the data everywhere, in Japan, in Iceland, in almost everywhere that I've looked, that's what we see.
It seems that we had a headline recently about how Governor DeSantis had reported that about half of the hospitalizations due to the virus were actually people who were vaccinated. And so there's these questions right now about the efficacy of the vaccine. There was a Politico article saying that the data that isn't published yet from Israel is suggesting that the efficacy of the vaccines is becoming less to some extent. What are folks to make of this?
Sure. So the vaccine story is somewhat complicated, but basically the vaccines have shown the following. Long term, they have been so far, I mean, we're only, say, eight months into the vaccine era. Long term, the vaccines have been highly protective against death. Over 90%. And I'm looking at the data from Israel. I'm looking at the data from the UK. Frankly, I'm to the point where I'm skeptical about the data coming out of the CDC, frankly. I hate to say something like that, but I look all over at the data now. I don't just blindly accept CDC data. They've been erratic in what they've said, and I think we have to, we trust who we trust for a reason. So I look at the Israel data and the UK data, and we see very good protection of the vaccines against death even now. There is no real evidence of serious waning of protection against death from vaccines. That's point number one. Point number two is there is evidence that people still, that the protective effect against symptomatic illness decreases over time with the vaccines. And that is true when looking at the data from all over the world. And so, yes, you can get infected even if you're vaccinated. Yes, a certain percentage of people do get serious illness, but it's still highly protective against death. So that means what do we do about the durability of the immunity with vaccinated people? Because we're interested in protection and we're interested in durable or long-term protection. And we know the following. Number one, protection against the illness is more robust and more durable, longer lasting from a natural recovery after the infection than it is from a vaccine in an uninfected individual. That is factually true and inarguable, although people try to distort that. And why do I say that? Because of the data. The data is very good from Israel, that shows that there's a 13-fold to 26-fold, meaning times, more symptomatic cases in people who have been vaccinated but never infected when they get eventually infected versus people who have had an infection in the past, never been vaccinated. They are more protected. And we never hear about this from the people who are mandating vaccines and everybody blindly saying that everyone must get a vaccine without regard for their natural immunity. And this is a huge public health not just error, it's a disgrace, really, that our CDC and our White House leaders of task forces are not talking about basic immunology. We know this is true for other viruses. We know it's true for SARS-1. 17 years after people who have had SARS-1, we look at their blood samples, and it has still robust immune response to SARS-2. That illustrates a cross-protection sort of mechanism, but the point is 17 years later. We know from Spanish flu, 90 years afterwards, we see people have protection against that virus, an immune response. This is not new ground. This is not something that's shocking. It would be shocking to think that people who have recovered from the viral illness do not have long-term protection. That would be the shock. And everybody who's a credible scientist knows that, but somehow we have disregarded all the information that we used to know. So we see there's another point that I would like to make about the measure of the protection. Antibodies decline after an infection over months, typically. That's common. That's not a cause for alarm. We don't give a booster shot or a vaccine just to we don't do that on the basis of antibodies. We do it on the basis of protecting somebody from a serious illness. We're not sitting there proudly displaying our antibody levels. We want to make sure people don't get sick. And when we look at that concept, we always seem to forget, or we don't forget, I don't forget, but the press and some of the most visible faces of public health on TV never educate the public about something very important, which is that when your antibodies decline after 4 months, 8 months, whatever it is, that does not mean necessarily that your protection is gone. So, because you have a long-term immune system in your body. This is not new. This is medical student first year college really level science, is that you have stored in your both T cells that people have talked about, as well as memory B cells that are in your bone marrow that provide protection for years. And there is evidence that this virus has shown that. This is not, it would be a shock if it didn't. So, you know, there's just a lot of misinformation again, and a lot of incomplete information, a lot of hysteria being unfortunately promulgated by people who should know better. If you don't know this stuff, you shouldn't be in the CDC. If you don't know this stuff, you should not be advising the President of the United States. And if you don't know this stuff, you certainly should not be on TV talking to the American public.
At least among the people I'm speaking with, there's an understanding, and you've already talked about this to some extent, that the vaccines, you cannot count on the vaccines to prevent infection. You cannot count on the vaccines to prevent transmission of the virus. But how does that work exactly? Because there's initially, once you get the vaccine, there is some protection from infection, but it seems to wane pretty quickly. I'm wondering if you could kind of unpackage this whole picture for us.
First, we want to make sure people understand the vaccines do protect against infection compared to people who did not get a vaccine. They do. And I want to make sure people understand what has happened here, in my opinion, in the discussion about the vaccines, is that there's been so much pressure and so many erroneous statements made trying to force people to get vaccinated that there's a too strong backlash against the vaccine. The vaccines are good. The vaccines are protective compared to people who didn't get the vaccine in terms of getting reinfected or getting an infection. But yes, it's true. It's not perfect. It's not 100%. It's in fact, in the Israel data, only 40% protective at some point in months and months later against all infection. So, but that's not to say that the vaccines are not good. They are very good. They are protective, and most importantly, like I said, they're protective against hospitalizations and deaths. The vaccine protection wanes over time. We've seen this in the studies in Israel. We've seen it in the studies in the UK. I saw some data yesterday in the Netherlands that showed similar sort of waning. So we don't have experience. I think we should start by saying this. This is the first mRNA vaccine that's been used, to my knowledge. This is a new type of technology here. And so we don't know the long-term efficacy of these vaccines. And by the way, we don't know the long-term side effects of these vaccines because they've not been used long-term. But we see that the protection against all infection and against other things like the load of virus in your throat is imperfect, and it wanes over time. But again, we keep forgetting the bottom line. The bottom line is we are concerned with the serious illness. We don't walk around checking people's throats for what bugs are in your throat. And I'll tell you why. Because you're walking around with the bacteria in your throat that causes meningitis. Okay, Neisseria meningitidis. You're walking around with certain forms of streptococcus in your throat that in certain settings causes disease. We're not there to sterilize people's nasopharynx. That's not the goal here, and anyone who thinks that needs to see a psychiatrist, frankly, and they shouldn't be advising people on this vaccine. What we are in favor of, our goal is to, again, to stop the serious damage, to stop the death. So the endpoints here have to be understood. Today I see some noise about Pfizer saying that the vaccines are safe and effective in children. And when you look at that, this is an example I'm sort of taking off from what your question is, if you'll excuse me, but when you're looking at, they say they're efficacious. Well, they didn't even examine anybody who didn't get the vaccine, so they cannot calculate efficacy at all. That's just simply not possible. They measured efficacy, it seems, although I didn't see the data, but from the article, it seems they're talking about they measured antibodies. Okay, they got a vaccine, they got a drug, they injected it into kids, and the kids mounted an antibody response. We're not, again, that's not the right endpoint. The endpoint is protection from serious illness or death. That's the endpoint. So, A, they didn't measure that, and B, these kids, unless you're severely immunocompromised or have a disease like leukemia, a child does not have significant risk from this virus. So you have to wonder, how can you measure efficacy for a vaccine against a disease that has no significant risk in these subjects, in these patients? I just think we're mismeasuring the endpoint here, is the long-winded answer to your question. The waning protection cannot be based on a test for antibodies. The waning protection must be, are you protected against the serious consequence of the illness?
Fascinating. So I think a lot of people, when they would hear you say that there's no risk for children.
I didn't say no risk.
Okay.
I said there's a very, very low risk, no significant risk. That's a term that's very different from saying no risk.
Okay.
There are children who die. There are children who get seriously ill, but the risk is extremely small. The words minuscule come to mind.
And there's also some evidence of side effects in children, the heart inflammation.
From the